According to the American Academy of Facial, Plastic, and Reconstructive Surgery, the rise in selfie culture is having a big impact on procedures. Its annual survey reports 55% of surgeons saw patients who wanted to look better in their selfies. That's up 13% from 2016. Now, the focus on achieving that filter look has sparked an uptick in non-invasive procedures. And here with what you need to know before you book your next appointment is Dr. Sundin from the Virginia Institute of Plastic Surgery. So thank you for being here this morning. So we were just talking about this whole selfie culture. What have you seen in your practice?
Well, it's really been an uptake in both not only the patients posting their own pictures on there, but also a lot of physicians doing procedures on there as well. And just the general ubiquitousness of imagery, high definition imagery in particular, has really made people more aware of early flaws in the aging process. That's kind of
When you have a patient come in, do they say, I want to look like Kim Kardashian or Kylie Jenner in this selfie, like smooth out? What are they saying?
Well, occasionally you get patients come in and want to look like another person, or they do like somebody's lips in particular and want to emulate that. But a lot of what we're doing is it's very difficult to make someone look like a different person, but to restore their natural beauty or fill in certain flaws or certain signs of aging, that's kind of what's more appropriate for it.
Are you also finding more younger patients?
Yeah, younger patients are definitely coming in earlier, whether it's for BOTOX or lip injections like Kylie.
When you say young, like what age are we talking?
Late 20s, early 30s, but which is like early 30s is probably a good age to start with some of these procedures, because you want to get it before it really starts to fall apart, and that way it's kind of like maintenance. So,
yeah, you had a good analogy during the commercial break. It's like maintaining your house. If you wait till the whole thing falls apart, then you're going to be
major reconstruction.
Exactly.
And you do a lot of things all along the way. Sure, maybe eventually you might need surgery, but you can postpone that farther down the road and do little things with a little downtime.
Gotcha. What are we talking about here? Are we talking about just Botox, fillers? Like, what are we talking about?
Well, everything from the traditional Botox and fillers, which really been around for decades. They've got it more popular, like I said, with the younger people. But there's also new technology that, like microneedling with radio frequency, that resurfaces the skin with a lot less downtime than traditional lasers. So it can help with fine lines, wrinkles, acne scars, and just a whole slew of other non-invasive procedures.
But how long does this last? Are we having to go back in every 6 to 8 months, every year?
With this device, it tends to last 1 to 2 years that you might need a touch up. So it's a longer acting device. Other devices such as just regular microneedling, which is totally different than this, that requires more treatments and more frequently. But this is more on par with traditional lasers such as Fraxels and stuff like that. So
now, how much are we going to get set back here with this?
With that procedure, it's typically a couple $1,000 a treatment. You typically need to start with 2 to 3. So,
oh, wow.
So it's not cheap exactly, but compared to traditional lasers, it's in the ballpark.
Wow. Botox?
Botox, you're looking about $500 a pop, so it should last you around 3 to 6 months. But
3 to 6 months.
It actually really does slow down the aging process. I feel if you start to get it before the lines set in, then you can extend it till you need bigger procedures.
All right. Well, where can we find out more about you if anyone has any questions or wants to know anything more about the procedures?
Well, you follow us on our Instagram account, drsundin.com, or on our website.
Perfect. All right. Well, thank you, Doctor, for being here today. I appreciate it.